Hey, what's going on? Dr. Taylor, Aspire Chiropractic. An interesting encounter with a former patient earlier this week. I say former, and you'll see why here. She comes in and she says, "Hey, doc, I want to stop care." "Why do you want to stop?" "Because I'm feeling better." "Okay, fair. That's what we're shooting for. That's my job, is to make you feel better, right?" She goes, "I want to stop care," and we are right about halfway through. I'm like, "Okay, well, there's still going to be stuff to fix, stuff to address. I understand your symptoms are less, but based on my expertise and my experience, I mean, hell, I've been doing this for over a decade. I can tell you right now, we stop now and you keep living the life that you're living, which was an active life, which is what we want. This stuff's going to come back." She goes, "But I feel better now." Perfect. That's what we want. We want you to feel better. So what I'm going to suggest then, let's take the frequency that we're seeing each other and let's stretch it out a little bit. Let's put a little more time between our visits. So that way, at the very least, we can still come back and we can check these things that are going on. She was someone who wanted to get back into working out. Her squat form wasn't as good as she wanted to be. It was causing pain, and that had all gone away. Awesome. You going to still work out? Sure am. Okay, so you're still going to put wear and tear in your body. Well, yeah, I guess so. So then it would stand to reason we should still follow up with that. She goes, "No, but my symptoms are gone. I want to stop." "Okay, that's fair. Your body, your rules, go for it." She goes, "Hey, can we take an x-ray?" "No." "Why? Why can't we take an x-ray?" Because there's going to be minimal change at best in your x-ray right now. There's no clinical relevance to take an x-ray at this point in care. It's unnecessary radiation. It's unnecessary time. "Well, I want to see them." "Okay, well, again, it's not clinically relevant. It's going to look the exact same." "Well, I feel different. It should look different." Not necessarily. And here's why. Okay. So let's say that you come in and you've got a big old scoliosis in here. Okay. And we are a small handful of visits in. What are we trying to do? And I'm going to tell you right now, a good number of you, hey, do you fix scoliosis? We improve it. We don't necessarily fix it. Very rarely am I going to take this and turn it into that. But I can take this and turn it into that. We can definitely reduce these curves, and I can prove it to you. We've got pictures of it. But I'm not going to do that in a small handful of visits. She goes, "Hey, I want to see another set of x-rays." I mean, if you pay for them, sure. I mean, it's again, they're going to look the exact same. You're going to be disappointed. So what do? We take some x-rays. Guess what they look like? The exact same. But you said that she's been under care. Yeah, we were, I want to say 10 or 11 visits in, something like that. Why didn't her x-rays change drastically? They changed minimally. They didn't change drastically. But then why were her symptoms gone if her x-rays look the same? Great question. So if we've got a bone and a bone, okay, we're going to look at them from behind, like that and like that. Let's say at the very least, we've just got some subluxations here. Let's take out any idea that there might be nerve pressure or anything going on. Let's say there's no disc issues. Let's say we've just got a subluxation. We've got a bone out of place, at the very least causing some muscle spasms, okay? So what happens? We get some motion and some movement back in these vertebrae, and all of a sudden these muscles can move better, right? They can contract and relax. They can stretch and extend. So if we've got tight muscles caused by subluxations in the spine, and we remove these subluxations, so now these muscles here can move and bend and twist, what are you going to feel? You're going to feel better. You're going to feel happy, right? But this here, when looking at a spine that looks like this, is going to still be doing on or about the exact same stuff, because you got to remember, it's not just one joint. It's not just one motion segment in here. There are 24 of these things throughout the entirety of the spine. And if we've got, we'll use this arrow here, let's say we've got this one that's causing pain, right? But then we've got a compensation on the two above it and another compensation on the one below it that aren't necessarily causing pain, but they got to compensate for the one that is most out of alignment. And then that's going to cause issues going on further up the spine here, because just from a structural standpoint, all this stuff up here is built on all the stuff down here. So if our foundation is jacked up, it stands to reason we're going to have some compensations further up top. This particular muscle, this particular joint segment, these ligaments in here, after a few adjustments, will absolutely feel better. People walk out here on visit 1 feeling better than when they walked in. But if without giving the proper amount of time to actually change the posture here, to change the habit, your x-ray is going to look the exact same in the short window. And then we're going to be upset because it doesn't look different. But then you're going to be confused because you're like, I feel different. I feel better. That means I should stop. No. All we've done here is we've removed the cause of the symptom, right? Which again, when you first walk in here is absolutely what you want. You don't want to feel the way you feel. But as your chiropractor, it's my job to have a plan greater than that. It's my job to get you beyond that. Because what do you want to do? You want to be able to do the exact same stuff that you've been doing. You want to do the stuff that makes you happy, and sometimes the stuff that makes you happy, in this person's particular case, was working out. Working out was what got her into this issue in the first place. So now we correct the stuff that the working out has done so she can continue to work out. But then if she doesn't keep up with that care, then she goes back to working out. And then what happens? First thing that's going to come back is the same thing that brought her here in the first place. And then it's going to cause this kind of stuff going on above and below if she doesn't come in here sooner rather than later. And then all of a sudden, this whole plan that we had laid out in the beginning to get her not only out of pain, but up and doing as well or better than she wants to do at or as close to 100% as possible. Well, she's back down here. We're going to have to start the whole thing all over again. Because in the grand scheme of things, it's really simple what we do here. If this line is your body working and functioning at 100%, this down here is the pain zone. From birth on, we beat ourselves up. We do this and that to mess up the spine, and we get down below a certain point, and we end up in the pain zone. This pain could be any number of symptoms. In this case, we're talking about this person's low back pain. So what did I do? I got her to there. I got her out of pain. But in no way, shape, or form was I able to actually get her up close to or near 100% because she wanted to get out of pain. So what's going to happen? I got her here. She's going to carry on with her life and keep doing the stuff that brought her here in the first place. But then what she's going to do, she's going to have to go somewhere else now and start all over. This is why when we come in here, we address your pain. But we also talk about the underlying stuff. We talk about the habits. We talk about your work schedule. We talk about your hobbies, what your life is like. Because we want to do more than just get you out of pain. We want to make you back up here, up to where you're doing your best. And then when we get there, we'll have recommendations on what to do. Keep it there so that way you don't end up down in the toilet again. But again, that's the kind of forward thinking we do here. That's the kind of plan we have for you here. Because that's the kind of person we want to make you. We're willing to help you when you're willing to be your best. Naturally, right here at Aspire Chiropractic.